going to talk very briefly about the link between cholesterol, hypertension, erectile dysfunction, as well as two other ailments or conditions affiliated to that. As well as, angina pectoris, that's the pain people feel in the middle of their chest sometimes, and they don't really know why. You understand? We're going to find the link between these issues and more. Guess what? As a bonus, we're going to find out why is it that sometimes people have high blood cholesterol and begin to have issues in the eyes. So we'll get the common link. But before we continue, let me introduce myself. I remain my humble self, Lucky, aka Dr. Drugs, and I'm here to take us on this very brief and very concise and well-packaged health seminar. And this topic is very, very important because it's actually what initiated this topic for today was a test result we received in the health and wealth team, where a patient or a team member had very high blood cholesterol. And he was very, very much unaware of this. And that's what prompted this health and wealth seminar for today. Hopefully, we'll be having more sessions like this where we'll try to close the gap between patients and health practitioners and try to explain things as simple as possible. So this is our table of content for today. We're going to talk about the two greatest assassins. And trust me, it's not going to be James Bond 007. It's not going to be Tom Cruise as in Mission Impossible. We'll find out what they are, and we'll talk about high blood cholesterol briefly. Then we'll talk about hypertension briefly as well, chest pain, erectile dysfunction briefly, eye health briefly. Then we find a way to link all these together. The greatest assassins are actually cholesterol and stress, because they are responsible for the most deaths and most death occurrence on earth today. Cholesterol, as we know, is the chief propagator of or chief cause of cardiovascular issues or cardiovascular deaths on earth today. And that's why it's very important, as well as stress that damages DNA. And we know that DNA is the MD CEO, head of board members, chief managing director of everything that has to do with us, and even goes further to even transmit information that we pass down to our offspring. And you see that these two factors finish humanity at the highest, and that's why they are the greatest assassins. What is high blood cholesterol? It's simply excessive detrimental accumulation of all forms of cholesterol except the good one. We have the bad cholesterol, as we all know, like the LDL, low density lipoprotein, and the very low density lipoprotein, amongst others in that class. But remember, we also have the good cholesterol that helps to protect our cardiovascular system and our body from the bad cholesterol by moving them back to the liver to be metabolized. Now, the symptoms include chest pain and leg pain, as in DVT, that's deep vein thrombosis, where the vein in the leg is blocked by cholesterol. And then constant risk factors include genetics, diabetes, overweight, poor diet, lack of exercise, alcoholism, which of course directly increases bad cholesterol, smoking. Then we have complications. Complications include heart attack or myocardial infarction, as well as erectile dysfunction, cardiac arrest, stroke, death, etc. So the major challenge is blockage of blood vessels leading to cell damage and or cell death of the affected area. The blood vessel here has been blocked by something called an atherosclerotic plaque, which is as a result of what? Cholesterol. So let's talk about hypertension briefly. Hypertension is simply defined as a sustained elevation of blood pressure above normal. Bear in mind that high blood pressure is not when one has a BP directly above 120/80. It's actually a range that ranges between 100 to 130 over 60 to 90. This is the formula for blood pressure. And this formula here shows that an increase in cardiac output, that is the rate at which the heart supplies blood to the body or pumps blood per minute, or an increase in the resistance to such a blood flow can actually lead to what? Hypertension. So basically, what this means is that anything you do to reduce the rate at which the heart pumps blood to the body or reduce the peripheral resistance can lead to a decrease in blood pressure. And that is why when people have this peripheral resistance, the heart pumps with a compensatory increase in pressure, and that is what actually leads to high blood pressure. But soon we're going to find out why this is actually possible, why this happens, and what we can do to resolve this issue. Cholesterol deposits are found here in this lower side, and you see that the heart will have to pump with a higher pressure to squeeze through this cholesterol blockage. And this cholesterol blockage, as you can see, is making the heart to pump with a higher pressure to squeeze through this blockage. Look at this other side here, very smooth and very free, and the heart will pump with lower pressure. And that's why you see that when we take away all this cholesterol blockage in quote, and you see that the blood pressure begins to come down in majority of cases. Let's bear in mind that we have two major types of hypertension, which is primary or essential hypertension, and we also have secondary hypertension. The difference is that the primary hypertension is of no known particular cause, whereas secondary hypertension is something that is caused by what we know. The only way we can measure our blood pressure is with a sphygmomanometer. And what that means is that you cannot know what your blood pressure is without measuring it. Blood pressure is not something that can be measured with eye gauge. You can't use your eyes to look at someone and tell if the person is actually having a high blood pressure or not. So one must have to use a sphygmomanometer to measure blood pressure. Now, what are the causes and risk factors? Of course, we know, looking at this cat over here, you can see this is an epitome of high blood pressure because you can see it's obese, definitely it's lazy, and you can see it must have been smoking because it looks high. You can see it's taking alcohol, excess alcoholism, further worsening the peripheral blockage and making it hard to pump with the higher pressure to overcome the blood blockage in the blood vessels. And you can see that it most likely will have high blood cholesterol amongst other issues. So prevention and management entails that we have to monitor blood pressure regularly. And also we have to avoid excess salt intake, exercise, and all that. But I'm going to give us an idea very shortly of what we actually need to consume in order to prevent or help to mitigate or avoid high blood pressure. Look at this beautiful picture over here. You can see this is all things bright and beautiful. What this means is that you cannot find any packet of Benson, St. Maurice, you can't find Hennessy, Azul, you can't find any lost dry gin or spirits and all that all here. You can see that this is all bright and beautiful, and that is how we are supposed to eat. Now, chest pain or angina pectoris is very, very simple to explain. Bear in mind that this angina pectoris is just an alarm by the cells of the heart that they are dying. The reason why they are dying is because something has blocked their blood supply, and as we all know already, that is actually cholesterol. You can see this fat man over here. I just climbed a few steps and he's already feeling that kind of pain in his chest. We have two types. It's either stable. Stable angina means that it is stress-induced, but the worst of them all is the unstable angina, which can happen at any time and is actually very, very, very dangerous. It's a sign that there's an impending danger. Bear in mind that it is a libido killer, erectile dysfunction. You see, this last Valentine's Day was a litmus test for a lot of men because you can see that a lot of men could not perform and they had to go and take all forms of things like the Viagra and all that. But let us ask us, why do people have erectile dysfunction in certain cases or instances? By definition, it's simply recurrent inability to achieve or sustain penile turgidity during sexual activity to permit sexual satisfaction over a period of time. That means it's not only about it even being erect, but actually the entanglement facility has to have a very high entanglement factor so that the owner of the entanglement arena will be very happy. Now, briefly, we're going to talk about sexual health because it's strongly linked with what we're talking about. It's defined as physical, emotional, mental, and social well-being in relation to sexuality. And a man must work and work well after working for things to work out. This is something that we need to go home and digest. Any man that reads this should understand what this means. Because a man must work and work well after working for things to work. So if this is defined as a recurrent inability to achieve or sustain penile turgidity during sexual activity to permit sexual satisfaction over a period of time, that means a stitch in time saves 9. Its symptom is basic: little, brief, or no erection. And guess what is the number one cause here on this list that causes this problem? High blood cholesterol. This is very easy to explain because engorgement of the tissue of the penis with blood through the blood vessels that supplies it is the basic process by which erection is achieved. Now, anything that blocks these blood vessels or hinders their performance as a result of excess, maybe cholesterol or something, you find out that there is a problem with the erectile function. As you can see from this diagram here, you can see this is just the basic process at which this is the, will I say, the ground zero. You can see where it's beginning to get excited, and you can see where there's full excitement with love in the eyes, and it has gone back to ground zero again. That is the normal process with which it should be. But we'll find out why sometimes people have this issue. But bear in mind that the eyes as well also need adequate blood supply to function. And the eyes, as we all know, are the windows to the soul. I just want us to look at the parts of the eye that we need to protect jealously or guard jealously. And you will see that there are some blood vessels that are actually behind at the back there, trying to, that supply these areas and are very essential for nourishment of the very, very sensitive and delicate parts of the eyes. So you can see that anything that affects blood supply to this area can actually lead to what? Impaired vision. The retina is basically the part of the eye that processes light and translates it into nerve impulses that enter the brain and is interpreted as vision. People believe that you see with your eyes, but on the contrary, you actually see with your brain. That is why sometimes one can be looking at something without seeing it because his brain or her mind is somewhere else. So this is a very essential part of the eye that has to be protected, and it's one of the major origins of damage because the optic nerve and the retina have to be highly protected and furnished with a lot of blood supply. Now, inside this retina, we still have another part that is also very, very essential. That is for very clear vision, what I call sometimes close to like 4K view. That's what makes the eye see very clearly. But you see, anything that hinders blood supply to that part of the eye can actually lead towards impaired vision. And let us find out, we'll still find at the end of the day that there's a common link to all these issues, and you can see how we'll talk about how we can actually mitigate or avoid these problems. So this is what the normal view or normal vision should be like. But when there's damage, as a result of glaucoma or other issues, you can see that grandpa cannot see his two grandchildren very clearly again. What is the link between high blood cholesterol and hypertension, chest pain, erectile dysfunction, and eye health issues? Cholesterol blockage is the common link between the aforementioned discussed health challenges. Look at this diagram very closely, and you see that cholesterol blockage or deposits as a common link between heart health and erectile dysfunction. That means even the upstream and downstream sector have a common issue, which is cholesterol blockage. So you can see that cholesterol deposits in the blood vessels that supply the penis leads to a failure of the penile shaft achieving or sustaining erection long enough for sexual satisfaction. The same thing happens in the heart as well, and also can lead to what in the blood vessels because of the increase in pressure to overcome the cholesterol blockage. One can have hypertension and can also lead to a heart attack, and removal of this blockage is key in reversal of cardiovascular issues and erectile dysfunction. So that's basically the link. Understanding the need for natural pharmaceuticals from basic principles. You see, for every action, there's an equal and opposite reaction. It's not every time there's an ailment or condition that the health practitioner that we give or prescribe chemical drugs. Okay. Now, these chemical drugs are designed oftentimes to take us out of danger. That is what their design is. And remember that disease in a general sense is just an excess of something unneeded or a shortage of something needed. That's just a general description. So you can see that in cases where people are having high blood cholesterol, you see that the cholesterol is needed, but it's in excess. And that means something has to be done to take that cholesterol back to the normal quantity that it is needed. So natural pharmaceuticals are basically packaged miracles that God potentiates to help us achieve our desired health goals. And hence, they simply add the extra to ordinary to help us achieve extraordinary health objectives. And it's worthy of note that they commonly have no side effects. The need for high quality supplements cannot be overemphasized, because we know that a lot of things are circulating these days in the guise of being very wonderful natural pharmaceuticals. Let us bear in mind that there's a very thin line between the conventional medication you take and natural pharmaceuticals. There are a lot of medication we take that are actually natural pharmaceuticals that have been repackaged. A typical example is your Daflon. Your Daflon, which is hesperidine and diosmin, is actually from orange peel extract. Your artemethyl lumefantrine, the artemethyl or the artesunate that has the sesquiterpene lactone ring, is actually from Guinghao, which is an Asian herb, and that is what we are swallowing today happily as anti-malaria. The willow tree is what you got the salicylate that has been acetylated to give you the acetyl salicylic acid. So don't be surprised that one may need essential fatty acids to help to disperse cholesterol aggregates in the cardiovascular system. Because they are from natural sources, we just term them as natural pharmaceuticals. One of the best companies I know that provides natural pharmaceuticals is Forever Living Product. They have been here for ages, about half a century, and their quality has been uncompromised and have given wonderful results to my patients. But let's just briefly look at how a few of them could actually resolve this high blood cholesterol and also assist with resolving issues like the angina pectoris or the chest pain, as well as the erectile dysfunction and the eye health issue. A typical example is this very product contains what is called eicosapentaenoic acid and docosahexaenoic acid. These are essential fatty acids that are essential for brain development. But guess what? They also help to prevent cholesterol. They also help to prevent cholesterol aggregates, have very powerful anti-inflammatory activity, hence can remove the blockage from the blood vessels that cause this issue as a result of high blood cholesterol. This garlic thyme you are seeing here contains what is called lecithin. And lecithin helps to what? Emulsify fats. That means the cholesterol that is blocking the blood vessels, especially the one leading to the entanglement facility and all these other ones, can actually allow for freer blood flow. Even the ones that block the blood vessels that make the heart pump with the higher pressure and hypertension, you see that this lecithin helps to what? Clean up the blood vessels. Bear in mind that an elderly man of about 90-something was asked what was the secret to his longevity, and he said that it was because he cleaned his blood vessels regularly. Hence, you see that these two products are actually very important with regards to what we're talking about today. These products, the function of these products is numerous. It's so much that we cannot talk about this today. It ranges from all parts of the body. In fact, there are books, volumes of books written because of this product. But whatever we want to know, you can always send a message and you definitely get a response. But just bear in mind that it has powerful anti-inflammatory qualities, and that is, it also helps to also prevent the aggregation of cholesterol in the blood vessels and heals the damaged cells and rejuvenates them after they have been starved of blood and oxygen and they may have had issues. Now, cardio health is a very unique product because it contains what is called coenzyme Q10. Now, this coenzyme Q10 has been scientifically proven to reduce cholesterol in the system. But guess what? It also helps to regenerate and rejuvenate the heart, the lungs, the liver, and the kidneys. And the heart is very essential in regards to blood pressure. And in fact, one is termed clinically dead when the heart has stopped pumping. So you can see that the blood vessels that supply the heart themselves need to be clean to allow the heart to function properly. This is a very unique product because it's an amino acid analog. What this means is that it has the capacity to help people that have had muscle loss or weight loss as a result of probably they've had a long-standing disease condition. That means that the muscles can actually, in fact, people that gym often go for this product, but that's just on the side. But it also has what is called L-arginine, which actually leads to the production of what is called nitric oxide, which is a vasodilator that allows for better perfusion and flow. Remember that the 4 ailments or conditions that we have aforementioned were actually as a result of poor blood flow. So you can see how important this is. But guess what? Just that it helps to encourage blood flow to the upstream sector, you can see that it can also help blood flow through the downstream sector, and you see that the entanglement facility will definitely function better, and madam will be happy in the other room. Multimarker is basically the sex herbs of the Incas, and you see that is also very essential with regards to improve sexual function, vitalize women, also helps for women, female hormonal imbalance, and you can see that women that actually in menopause or approaching menopause have a lot to gain from this. And then we have vitalized men, which of course is good for male sexual function and performance. Then we have the eye vision. Remember, we mentioned that blood vessels will be blocked to the eyes as a result of cholesterol, and they need to maintain the retina and the macula, which are essential for vision. And then we have B12 plus. Remember that your nerves are connected all over your body, and these products will help to regenerate and rejuvenate nerve cells that have been damaged. Bear in mind that the optic nerve is very essential for vision, as well as the retina. This product is also very essential there. But guess what? On the side, it helps to reverse what is called megaloblastic anemia. Hence, and it's also very good for sickle cell patients and a lot more. So, ladies and gentlemen, because of time, we may not be able to continue, but I just want us to understand that we're going to be having these sessions from time to time. So the next time we're going to have this, we're going to have a more organized and a larger venue where we can have time to entertain questions and allow people to comment. This is just like a test run or a pilot scale, and we're going to have this regularly. Kindly remember that these sessions are just to help people that are suffering in silence, so that they will also know whatever condition they are having, because the problem known is half solved. Let me leave us with this, and before we begin to send our messages via WhatsApp, because wherever you got this link from, send your message back or your questions to that link or via WhatsApp, and we'll definitely attend to every single person. Bear in mind that you are what you consume, and there's a constant battle between factors that repair and protect our bodies and those that break it down. So we have to be on what? The winning side. I really appreciate your time and your patience. I always make sure I have very brief seminars or health talks, and so you can be assured that your time will not be wasted, and you can ask your questions via WhatsApp, and I will definitely give you the answer. So I thank everybody, all our health partners in Health and Wealth Forever. I also say a very big thank you to my mentor, Dr. Clement Idigo, who is a very senior surgeon, 45 years experience, Madam Justina Ekperigin, and other members of our health team. I give everybody a very big salute, and remember that next time we're going to have this in a more organized way, and we'll have time to ask our questions. But for now, kindly post your questions back to WhatsApp, and definitely I will answer everything you ask by the grace of God. Thank you very much, everybody, for listening. Thank you very much for listening, everybody. I really appreciate, and good night.